Good day everyone, my name is Jana Maria Alvarez and today I will be presenting to you a disease that is a viral, which means it is a contagious disease. So in this day, I'll be presenting a viral disease in the nervous system, which is the rabies. So as you have known, you already known this kind of the disease because very common kayo ni siya sa ato ang mga Filipinos because pakita na to siya sa ato ang community. So, unsa yun ang rabies disease? So, kaning rabies is a lethal infectious illness that has been around since the 23rd century before Christ and is found practically everywhere. So, sugod pa lang sa pinakauna na anajud siya ang kaninga virus. So, effective control procedures in the affluent world conceal the reality that rabies remains a major hazard to human health in underdeveloped nations, killing more than 55,000 people each year. Rabies is a zoonotic illness caused by an RNA virus from the Rhabdoviridae family, which is a genus Lyssavirus. So, this rabies is virtually often lethal once clinical signs arise. So, also according to the World Health Organization in 2021, the rabies virus may affect any species including humans. So now let's proceed to its transmission. The most fluent method or the most frequent method of rabies transmission is an animal bite. We already known this kind of disease or illness. So, kabalo na jud nga gikan siya from an animal bite, which is infected na ang kanang animal. So, through wounds or direct contact with mucosal surfaces, the rabies virus can enter the body. The virus cannot pass through healthy skin. So, dili lang basta-basta makasulod ang kininga virus if ever dili kaninga tao is naka direct contact sa infected na animal or ang ihang wound is na contained ato nga infected animal. So when protected direct contact with a patient secretion carrying a live virus occurs, the interaction with infected person might pose a risk to their family and medical professionals. So if ever dili gani mahatagag attention ang kana nga tawo nga nagdala na og live virus or na-infected na pud siya is possible or naay risk na if ever kana iyang family or iyang ma-encounter nga person nga nagka-interact siya is pwede siya nga ma-contage or ma-apektahan pod. Ma-infect. So, bite wounds in the head, neck, face, and hands, especially when there is blood, provide the highest danger and often have a shorter incubation time. Because the rabies virus can remain for a long time in muscle tissue, there may be occasionally a chance for host immune clearance and post-exposure therapy. The next slide is its etiology. So the Rhabdoviridae family of viruses that are bullet-shaped and composed of two parts that causes rabies. So muna siya ang structure sa kini nga virus which is nagka-cause og rabies. Ingani ang form mga siya bullet form. So the first part is considered more structural and is viral envelope, while the second part is more functional and contains a ribonucleocapsid core. The virus is most commonly spread through the bite of an infected animal, including domestic and wild ones. But transmission can occur from saliva to broken skin or mucous membrane. So, matransmit pa jud ang kaning viruses if ever magka-contact og or mapaakan ang isa ka tawo sa infected nga animals or to sa laway ani nga tawo. Its sign and symptoms. So initially, signs of rabies such as weakness or pain, fever, or headache may resemble to those of the flu. And additionally, there can be pain, prickling, or itchy feeling where the bug bit you or the animal has bitten you. So this may be a sign. So if the signs might persistent for many days, then possible nga nanadyo kay rabies ana. Since makabalo kang ipaakan ka and then magluya ka. And of course, for many days magsigod na mag-continue na ang signs nga sakit muna na siya na need na dyan mo og medical attention. So the symptoms then intensify to include agitation, anxiety, disorientation, and brain malfunction. The person may have this drowsiness, strange behavior, hallucinations, hydrophobia, or fear of water, and sleeplessness as the illness worsen. So as we have all known nga, ang kaning rabies virus is, or the rabies illness, is kaning siya nga virus kasi nga part sa zoonotic family is nakakause na siya og malfunction sa ato ang nervous system. So that is an explanation why maka-encounter ta nga symptoms if ever natay virus patwa. So as part na sa anxiety, disorientation, o brain malfunction, wala siya na afektaran ang ato ang nervous system if ever naatay ingani nga virus. So symptoms in animals are often similar to those in humans. This includes early non-specific symptoms, acute neurologic symptoms, and ultimately death. So if ever natay symptoms ani nga napaakat la, syempre ang katong naay rabies or infected animals na nipaak sa tuwa is possible nga kung sa imong naibati, mo po na mabati, and worstly, pwede po mamatay katong not treated. So sign na to siya or symptoms. So management of rabies or treatment. So ang mostly or ang very effective jud nga management ani nga illness is prevention. So kabalo man jud nga prevention is better than cure. Prevention is the mainstay of treatment, including programs involving domestic animal vaccination, education, and monitoring. Rabies is preventable through 3 proven effective intervention by the World Health Organization. So una na ani is awareness of rabies disease, engage communities, and empowers people to save themselves by seeking the care they need. Second is post-exposure prophylaxis, which is the PEP, consists of a series of rabies vaccines and in some cases rabies immunoglobulin, which is the RIG, administered after a suspected exposure to rabies. So part of this is in inappropriate wound management if ever napakan ka or nagka-contact ka ato nga virus or illness. Lastly, ang management of rabies treatment is mass dog vaccination or mass animal vaccination, which is very effective, proven and tested, cost-effective way to save human lives by stopping transmission of rabies at its source. So eliminating rabies in dogs or in animals is therefore key to sustain preventing human diseases. So muna siya ang mga management for us to prevent or for us to not be infected in this kind of illness. Next one is the trends in the Philippines. So sa ato ang lugar is researchers have found that since 2007, there have been 200 to 30 rabies deaths per year in the Philippines, despite the fact that the standard intradermal vaccination regimen was introduced in the country in 1997, and that animal bite care center are equipped for advanced treatment with rabies, a medication to provide protection against rabies. So sugod pa natong una na ana jud vaccination ani nga illness. But then dili jud maingon nato nga ato ang country is a nation nga rabies free nga country, because daghan jud kayo mga animals na dili pa sila free from rabies, or sila man gud ang source sa kaninga illness. So dapat ma-rabies free sila. And in order for that, kailangan sila ma-vaccination aron if ever na mapakan, dili na kuan. And then ang problema lang kasi nato diri is dili jud tanan ma-vaccinationan ang mga animals. So na yun sa range of 200 to 30 rabies deaths per year sa Philippines. So may kaingon dito dili jud not yet rabies free ang kaninga country. So compared to the same period in 2022, there have been 8% more cases and fatalities. So the pathophysiology of this illness is the infection eventually leads to total breakdown of the entire nervous system, which results in a swift death and is known as hydrophobia. Animals typically pass away within 10 days, although the incubation period that follows vaccination can run anywhere from 2 weeks to 6 weeks or 6 years, with an average of a few months. The viral load, the site of exposure, and the severity of the lesion are determined variables for the timing of beginning. When clinical signs appear, rabies is always life-threatening. So, ang kaning virus is mag-start ni siya from its source, which is the animal na infected ato nga virus. I mean, dili man tanang animals na adjud ani nga virus. Ang katulang mga infected food nga mga animals. So first is the source, which is kani nga infected animals, which is the virus. If pagpaak sa tao, so the virus enters via animal bite, and then virus replicates in the muscle at site of bite. After that, virus will infect the nerve in peripheral nervous system, moves by retrograde transport. And then, it replicates in dorsal foot ganglion and travels up to the spinal cord and then to the brain. After the virus travels from the brain, then via to the nerves, into the other tissues such as the eye, kidney, salivary glands. So muna siyang maka-experience ang tao nga infected ani nga illness is maglaway-laway, and then dili na jud sila maka-function, dili na jud mag-function og tao ang ilahang panguna-una because of this kind of virus. Since naapektuhan man jud ang ilahang brain. So if ever maapektuhan ang brain, meaning dili mag-function og tao ang ilahang lawas, ang ilahang mga organs sunod sa ilahang lawas. Lastly is the conclusion. So despite of the World Health Organization endorsing several programs, rabies cases have continued to occur in Southeast Asia because financing of preventive programs has frequently been ignored and given low priority. Among the reasons that lead to rabies incidents in Southeast Asia are the large number of stray and unprotected pets, the workplace danger, the lack of the rabies vaccination in rural regions, as well as the misinformation regarding the specific of receiving medical attention after bites. So this is why important kayo ni na topic ang i-educate ang kaninga mga tao tungkol anin sa illness, because proper care leads to wellness. So if ever makalantaw man nga video is unta matagan og prior attention ang kaninga topic because makita naman ko na ito nga almost all talented sa drugs and teenage pregnancy ang all sa ilahang mga topic and programs, and then kung nakalimtan na din nila ang pag-prevent sa virus, which is very common kayo siya kay daghan jud kayo iring bisag sa pang animals ang nagsurround sa ato, which is the care of basin ka care for nga virus, and we should all be vigilant also in providing medical health attention, health care, and also how to be preventive in such kind of disease. So that will be all for this presentation. Thank you for watching.